Good morning. Welcome to our Acappella podcast. I have a great guest today, physician Dr. John Roland. He is an ER doctor and works in functional medicine. This is Joe with Acappella. I'm working from home, trying to stay safe today as a nurse. And so I'm very pleased and honored to have you, Dr. Roland, and we're going to talk on Corona. So I've got a lot of listeners that are senior healthcare professionals. Adult children of seniors, and then a lot of friends that are in home health and hospice that aren't actually in the hospital, but they're seeing patients on the home front. And we are just as valuable to this healthcare team as the hospital staff, but we have a different dynamic going on. And that's what I want to talk about today. So my first question, Dr. Roland, how is Corona different from the flu?
Well, I think the real problem with this virus is that it has such a long time before patients become symptomatic. And so it's causing great trouble in trying to track people down. And so it spread, just like the story about the choir up in Seattle where they had singing practice and so many people got sick. People don't have symptoms initially and that they're spreading virus. So, and it appears that they could spread virus for as much as a week or two before they become symptomatic. Most people become symptomatic in about 5 days. The other thing is that the mortality rate is somewhere between 2 and 4% in the population. So that's what's leading to god-awful losses in susceptible populations. And we talked a little bit about before about those populations, and I'm sure we'll talk more about that. But certain populations like elderly certainly are more susceptible to this, succumbing to the disease.
Mm-hmm. So, if for the healthcare professional, what are some symptoms that we look for that that we should question before we go out and into the public and take care of patients?
Oh, so as a healthcare worker, what you should be watching for? Well, frankly, any type of illness that you're having, you really ought to question yourself about whether or not you should be working. One of the things that we're now doing, and it's fascinating, Joe, we're all learning about this, and we joke about it. Every time I go to work, I have a new set of rules that we're operating by that day, even down to who it is that we're testing and who that we're not testing. But for employees, we are now checking our temperature twice a day, and we're reporting any symptoms that we have. And sometimes you may not know. Just at the end of my session the other day, I started developing just a little bit of a runny nose, and I wondered whether or not I was coming down with something, regardless of, and whether or not that reached the limit. Fact is, I went home that night, I took some vitamin C, I slept very well, and by the way, sleep is very important to the recovery of the immune system, and I didn't have symptoms the next day. So, but we have doctors and nurses and associate healthcare personnel reporting mild symptoms such as cough, and we are eliminating them from the workforce until their symptoms have cleared. We even provide a buffer of 3 days. You must be symptom-free for 3 days before you come back to work.
Mm-hmm. Well, and we had a nurse yesterday that showed up at a business. We have nurses going to businesses and just checking temps. She was just a little dehydrated, and she did show up with a temp. So she was sent home, and it's really better to be safe than sorry. And, that's just great information to know because, you might have a symptom. It's not Corona, but you want to protect the people that you're serving as well.
It's fascinating you report that. Being in the emergency room, we see all comers, right? And certainly those that are suspected of having COVID and those that aren't. This social distancing has decimated the flu. Not only is it getting warmer and we're getting out of the flu season, but all of a sudden over the last 2 weeks, I haven't diagnosed any flu
Wow.
patients. And so that shows you how dramatic of effective this is of social distancing to common viruses.
Mm-hmm. So question then, when do you go to the hospital? If you've got temperature, you've got a cough, you're short of breath, when do you know it's time to go to the ER?
Well, I would say that as you're getting sick, you're monitoring your symptoms, and now is the grandest time to make great use of telemedicine. That is a great way to contact the medical community, and a safe way also for those doctors to care for you. And so runny nose, cough, congestion, no, you don't need to go to the hospital. Start running fever, and depending on the symptoms, they may suggest to you to go to certain locations to get, let's say, COVID testing. We are generating safer areas to evaluate patients. It still is a bit of a challenge, because if you come in with any type of cough, congestion, fever, fatigue, any kind of contact with the person with the travel or whatnot, then we have to consider you as a COVID patient. And so bringing somebody into the emergency room or a waiting room presents risk to all about. So one of the interesting things that not only our hospital, but other hospitals are starting to do are setting up tents outside. Mm-hmm. We can do some minimal things out there and not contaminate the rooms. And you say, well, what do you do about the outside? All we then need to do is spray the area with a little bit of bleach, and we've completely protected the hospital, and we've attended to the needs.
So Dr. Roland, you've got symptoms. Let's say I've got a temperature of 100.2. How do I go get tested? What do you recommend that I do?
Well, I think that now is a great time to make use of telemedicine. Mm-hmm. Telemedicine is a safe environment that you can seek medical care, and safe also for the doctor in treating you. So you can go through the symptoms. He can prescribe basic medications and help guide you. Now, certainly if you have fever, fatigue, and maybe a dry cough, you can be directed to locations to get COVID testing. And currently, the American Airlines Center is one of the locations that you can go down and get get tested, and it's free. Then you get notified a couple of days later about the result of the COVID.
Okay. I know that I heard of a nurse that did home health, and she went to get tested 2 weeks ago. She had a fever, wasn't feeling good. She's fine, but she's never gotten her results.
Wow.
And they told her, if it's negative, we won't call you. But her employer is uncomfortable sending her out in the field, which I understand. I would be. So, what are your thoughts on that?
I was talking with a patient that we suspect has it. And she got a phone call, and the phone call read spam. So she didn't answer it. And that was the health department trying to contact her.
Wow.
And so, then she tried to call back, and there were no numbers no answering, nobody's answering. And they said that they would get back to her when her number came up back in the queue, and that ended up being 3 days later. Wow. It was very curious that her test was negative. And yet her symptoms are clearly suggestive. And we know at least the first wave of testing here have an error rate of about 30%. So it leads me to the other question is that, well, I still think she has it. Mm-hmm. And so it's difficult. Return to work is another very difficult question. And there are people out there that never get tested, that have an illness for a few days and just never go down to the free testing site or go to their doctor and then return to work. So that's a risk, and that's a problem. Currently, the rules that we're having is if you have a confirmed case, you have to test negative twice, separated by 24 hours before you return to active duty. That can be 2 to 8 weeks from the time of onset.
Okay, that's a long time. Okay, what about those people that have it, they've tested positive, they're not sick enough to be in the ER. So what, as a doctor, what do you recommend that they do when they get home?
Well, officially, there's no official treatment for it. There's nothing FDA approved. And so you're given very little from the CDC guidelines about what to do. All of the usual things are important, such as hydration and checking your temperatures and getting good rest. Now, that's where I'm going to put my functional medicine hat on from a standpoint. And functional medicine is a style of medicine where I'm really looking at totally integrated look at an illness. Why did you get sick, and what are those things that we can do to help you get better? And frankly, we've kind of forgotten to ask that question in many cases, like with MS or lupus or something. What are those things that you could do to reverse the course of that? And surprisingly, with interventions with nutrition, you really can make an impact. So what would I say about viruses? Viruses really respond well. There is a reason why you sleep a lot. Your body needs it. You certainly need hydration. And personally, I am very intrigued about some thoughts about fever. I don't necessarily treat the fever. When we allow the fever to go, it actually spikes and stimulates certain segments of the immune system. And that allows you to fight this virus. It even is as specific as this, is that we don't suggest anything except Tylenol. It has to do with prostaglandins and the type of stimulation to the immune system. I am even curious about doing things like having you take a hot bath. And this morning, I even turned out some response of your immune system of stimulating natural killer cells, such as monocytes and whatnot, which are that first wave of the immune system to fight the virus. Remember, we become symptomatic at about 5 days after inoculation. And then we have about a week where we're slowly getting worse. And we're trying to figure out, is there something during that interval that we can make a difference and actually get us better? Is there an antibiotic that we can take? Is there some kind of intervention? Well, allowing the fever to go and maybe even inducing a higher temperature in your body by getting in a sauna, let's say, or a hot tub makes sense. You can generate your temperature up to 100 to 101 just by getting in a hot tub. And that does stimulate your immune system. So I am suggesting that in my patients. Now you have to watch out for hydration. Want to make sure that they're not losing too many fluids, and make sure that they're rehydrating themselves when we're starting to talk about allowing the fever to go.
Well, that's interesting. Well, I remember I had the flu, a really bad case of the flu several years ago. My husband did too. And one day, the only thing that gave me any relief was taking a bath. And I took 11 baths the day that I felt the worst. But it was really did. I did feel better, So what should you be eating? Let's talk about diet. What should you be eating if you do have the virus, or if you don't, and you just don't feel good?
So a general recommendation about that is that we need to increase our vegetables, especially in this situation, citrus fruits that have a lot of vitamin C, green leafy vegetables. There's a concept that there is such a thing as an anti-inflammatory diet, which is limited meats and ample vegetables. I like things that are in season. The last few days that a fruit stays on a tree, it gets much more nutrified, has much more vitamin value to you. Certainly hydration. And that certainly is stimulating to your immune system. I also advocate extra vitamin C. If you're healthy, you can take about 3 grams before you get rumbling of the stomach and maybe a little bit of diarrhea. But when you're sick, like with a virus, including COVID, you'll find that you can tolerate 5 to 6 grams. That's 10 to 12 pills. And I suggest taking them 2 every hour until you feel a little bit of rumbling of your stomach.
Okay, that's good to know. And I've heard that on the news too. I've heard that on CNN and Fox. I kind of switch around, and I've heard that. And I've been taking that just as a proactive measure with my vitamins. You talked about zinc when we were talking about yesterday,
Yes.
talking yesterday to prepare. Tell me about zinc and how that benefits the body.
Well, we've known for a good while that zinc is somewhat effective against coronavirus. And I'm talking about coronavirus that causes the common cold.
Mm-hmm.
Coronavirus, zinc, when it gets into the cell, actually inhibits one of the first phases of the infection. So this is a little bit technical, but the virus latches onto your cell. It inserts viral RNA, not DNA, but RNA. And one of the first things that happens is that it produces an enzyme that makes more copies of the RNA. So it happens that zinc inhibits that enzyme. So if we can inhibit that enzyme enough, and if we can activate enough monocytes and natural killer cells, then we can shut down that infection, or at least limit it at that first basis. Now, that brings about a discussion also about hydroxychloroquine, which has had a lot of news about it. One of the mechanisms is that hydroxychloroquine opens up the zinc channels. So it may be the mechanism by which it helps people recover. Now, I say recover. What we've seen so far in patients treated with that is that their viral load, the amount of virus that we detect in serum in different ways, lessens more rapidly. What we have not proven so far is that it actually reduces or helps people recover. But that's those studies are ongoing, and frankly, we'll know about them within the next couple of weeks.
Yeah,
it'll be very close.
That's so. Who are the high-risk groups? Who are the ones that are catching this virus and more susceptible to the virus?
Mostly, it is those that have limitations over their immune system, like diabetes, anyone with lung disease like COPD, or heavy smokers are certainly at risk. Obese patients are at risk. Anyone with autoimmune conditions that take medications that suppress their immune system. Lupus, rheumatoid arthritis, ulcerative colitis, all of those patients. There's certainly concern about cardiovascular disease. There's certain concerns that the blood pressure medicines that we're putting people on may raise the population of receptors that allow the coronavirus to attack those people maybe a little more aggressively. That's of concern. And certainly elderly. Those above 60 appear to be at higher risk.
Okay, that's great news. What can we do to recover from the disease? So somebody that 80% of us that have those mild symptoms, what do you do to help recover?
Certainly, and I mentioned it before, but getting good rest and good nutrition. I would Stimulate your body each day. Make sure that you got up and got a little bit of exercise. Walk in your room. One of my patients in the morning gets outside and she goes to her porch, a safe place away from others, and does some deep breathing exercises, monitoring her symptoms, and certainly, vitamins, a multiple vitamin C, vitamin D, and then, of course, avoiding medications like Tylenol and not Tylenol, but I wouldn't treat fever. And I would think about some of the things with the saunas and hot baths as we talked about.
And you talked about, too, yesterday when we were talking about a pulse oximeter.
Yes.
Yes, and that would be good. And you can get those at Walmart, your local drugstore, just to check your oxygen level. And what level should they be of concern?
Those that are less than 94%, we start worrying and being concerned about. And it's very curious because people are presenting to the emergency room not particularly bad, but we check a pulse ox and we find it low. Mm-hmm. So it kind of sneaks up on patients. So like through your organization, being able to monitor O2 sats is a very important thing. I kind of cross over. I work in the emergency room and I also have some private patients. And so monitoring pulse ox, when we can get that to them, that's a very important parameter.
That's awesome. You've just had such great information. So just two more questions.
Sure.
Hand sanitizer or soap and water? What's best?
Well, both of them kill the virus. Both of them remove the virus. The key thing about mechanical soap and water and hand washing is that that's absolutely necessary anytime you've got any particular soiling going on. Mm-hmm. So if you come in contact with blood or mucus or saliva, you're going to be wearing those gloves. Certainly, hopefully you've done that. And then once you've gotten the gloves off, then I would do the aggressive hand washing for more than 20 seconds to remove any kind of particulates.
Okay.
Hand sanitizer is very good, and it's the quick and easy once you get off, and we should be doing it frequently when we have those supplies.
Mm-hmm. That's awesome. And then cleaning products for the home. What do you recommend? I've heard different things that Lysol spray doesn't work. It's not attacking the right COVID. Give me some insight on what do you recommend as far as keeping your house clean? What are your thoughts?
I have not heard that about Lysol, and I'll need to check on that. But what we have been told in the emergency room is that this virus is very easy to kill, and even a dry environment for a couple of days does it. As a matter of fact, we are reusing masks by putting them in a paper sack, and leaving them for 72 hours. And then we can reuse them. Yes.
Wow, that's great to know.
So the virus dries out and it just can't survive. So any bleach, certainly I use Lysol at home, and I'm going to check on it now that you warned me about that. But any of the routine soaps, any of the bleaches, any of the sanitizers, all are effective against this virus.
Okay, that's awesome to know. And then last question, Dr. Roland, if you had a crystal ball, when do you think we're going to be able to return to normal?
I think that what's going to happen is that, and again, the numbers today look particularly favorable, and we'll see if that trend continues. It looks like Texas has really responded very nicely. What I think is going to happen is that we're going to phase in the economy with those that have low risk factors, those young and healthy persons that if they happen to get sick, they'll be returning to work. And I think that'll be late May, early June. And then as we are able to tolerate and as we identify more about this, we'll be phasing in other segments of our population. There's still a lot that we don't know about this. You know that as well as I do. But frankly, we still don't know how many people out there have had it and don't have any symptoms. That testing still is very limited. We don't know that answer.
Yeah, I know. Well, I'm just hoping that we can get through this. And thank you so much. If somebody wants to reach out to you, I know you do have your private practice. Is there a number they could call, or do you have a website?
I do. I have a website. It is evolutionmedicinedallas.com. And I would welcome people inquiring. Absolutely.
Awesome. Thank you so much for your time. It's been awesome. I want to have you again on the show, and just have a blessed day. And thank you for doing what you do and caring for our clients right now, our patients right now.
Joe, it's been a pleasure. I'll be back anytime. Thank you very much.
Thank you so much. And you have a blessed day.
You too.